Hello, my name is Susan. I'm going to go over the post-op instructions with you for tooth extractions other than wisdom teeth. Before I do that, if you'd like to watch this video again or any of the other videos, you can go to our website at www.summitcenter.com. When you get there, there will be a bar across the top of the page. You click on patient care and you go down to the video or the post-op instructions that you want to view. When we have teeth taken out, other than wisdom teeth, we don't usually have to do jaw stretches. However, they can be done. It's entirely up to the patient. You may or may not have sutures, but if you do have sutures, they will dissolve on their own, usually in a week to 10 days. Now, for the first 24 hours, we don't want you to do any brushing or saltwater rinses. But after that time, you will require a soft toothbrush, whatever is normally used for toothpaste, and when you get to where the tooth was extracted, just very gently sweep or swipe over the surgical area and the sutures on either side if you have any. We want to avoid letting plaque build up. If plaque is allowed to sit on the area, it's bacteria, and that will increase the risk of developing an infection. Also, in 24 hours, you will start doing saltwater rinses. It's very important to stick to the amount of salt to water that's on the paper. So you would take 2 cups of water, 1 teaspoon of salt, you mix it up, and do 8 to 10 saltwater rinses per day with that. So anytime you have anything to eat or drink other than water, and before you go to bed, is when you would do the saltwater rinses, or whatever's required in between to get the 8 to 10. You can either leave it in a container on the sideboard, or if you have to go somewhere or leave your house, you can put it in a jar and take it along with you. Now on day 4, we're going to ask you to start using the Monoject syringe. The purpose of this syringe is to flush particles of food and debris out of the extraction sites while they're healing. It will need to be used after meals and before bed. It can be filled with salt water or tap water. It makes no difference. You will need to stand in front of a mirror, pull out on the cheek, and find the opening, and just put the tip to the opening. If it's on the bottom, you can gently put it in the opening. If it's on the top, put it right under where the opening is, and give a good push. It's 1 to 2 syringefuls for each upper site, 2 to 3 syringefuls for each lower site. You probably won't see anything but clear water when the water's spit out from the uppers, but from the lowers you usually see a little bit of blood mixed in with the water at first, and then as you're eating more, you'll see particles of food and debris. The Monoject syringe is to be used from day 4 until the follow-up appointment, or until the sites are entirely healed. And that could be anywhere from 2 weeks up to 6 weeks. Now you're going to have gauze in your mouth, and the gauze is going to have to be changed hourly until it gets to a certain point. If it's a single tooth, you would change it hourly until it's 25% or less saturated with blood. If it's a tooth top and bottom, you would change it hourly until it's 50% or less saturated with blood. It is normal the first time the gauze comes out for there to be more blood on it than there is when we change it here. And it will go probably from a dark red to more of a pink or brown. Once we reach the pink or brown stage, that's not considered bleeding anymore, even if it was more than 25 or 50%. Now you will be sent home with packages of gauze, and each package contains 4 pieces. For each area, if they're the larger teeth at the back, you would take 2 pieces of gauze and put it together. You would fold it until you can't get it any smaller. If that's as small as you can go, it's fine. If this is the tooth line and this is the cheek, you would put the gauze in and close. You want the gauze on the tooth line, but the bulk toward the cheek. If it gets too close to the tongue, it can make you gag. Also, if you have teeth top and bottom, this takes care of both. Now, if it's an anterior tooth, one of the teeth in the front, and you have other teeth beside it, you will only use 1 piece of gauze. And it's the same thing. You will fold it until you can't get it any smaller, and then you gently put it up in the area where the tooth was extracted. When it's a single piece of gauze, when it gets to be 50% or less saturated with blood, you don't have to put any more gauze in. The instructions for the medications will be given to you by whoever sees you out. If you do have any concerns, any questions at all, you can call us at 902-892-7600, or you can go to our website, www.summitcenter.com, to review the instructions again. Thank you.